We became aware as early as 2013, 2014 that there was a gap in our continuum. We're fortunate that we have excellent acute services here at HHS. We have fabulous rehab services, but we saw a gap in the transitions of patients. So getting them to a state where when rehabilitation is over, positioning them to their next living environment and getting them settled in that environment. And that's where our partnership with Connect came in.
From day one, with our partnership with Hamilton Health Sciences, we presented some lunch and learns, and we've had great opportunities to be able to meet with the teams within the HHS, and that gives us cool opportunities to share what our life redesign model is and what Connect is all about, and the kind of the look and the feel of Connect Hamilton.
I know my short stay in hospital is not enough rehab to put me back to where I'd like to be. So I'd like to get back to using a cane.
So patients are identified from both our internal hospital system as well as from the community. From there, I do my assessment, which is starting the conversation form. So I'll meet with the patient, usually in the hospital unit where they are, find out what their goals are, what their status is, what they want to work on, and as well as gathering a lot of information from the hospital team.
Once the individual's been identified, the person's been identified, that gives me a really cool opportunity to go and meet them where they're at in the hospital or in the rehab setting. And it gives that personal interaction, which I think is really special for someone who, has had a major traumatic event happen to them in their lives. And, they're really wondering about what that next step looks like.
We knew that our role initially in the acute world was stabilizing them. In the rehabilitation role, it was addressing their goals and enabling them to become as independent as possible. And that Connect offered that last piece of the continuum that gave them coaching and gave them life experiences that would then fully position them to integrate back into the community and interact with their environment.
Really ready to move on to transitioning those rehab goals that are in a hospital setting to more of a community home-based setting. So the goals that are meaningful to the patient, the individual, they can be identified very clearly and then transferred to Connect so that they can help them meet those goals in more of a functional, natural environment.
It really is a setting that allows awesome opportunities for socialization and for the individual to work at their pace on things that they want to work on. Our life redesign model gives an opportunity for people to truly redesign their lives after brain injury and stroke and identify what those goals are. And they're the ones that are driving those goals, and we're just here to support them along in their journey.